We suggest people speak to their doctors about their own medical situation. This information is intended for an Ontario-based audience. Thank you and have a great session.
Okay, hopefully everybody can see me. Thanks so much for joining us, and welcome to our last session of the day, Expectations versus Reality, Identifying Challenges with Post-Kidney Transplant. My name's Dan Slater. I'll be your moderator for this session. I hope you had a chance to join us in the morning sessions and learned a lot. I'm a director and a filmmaker based in Toronto, and I've been a kidney patient for 4 years. I received a pair exchange kidney transplant just over a year ago, which was 2 weeks after directing my first major film, which is a bit wild. I also do peer support with the Kidney Foundation of Canada to help build awareness, support, and hope to all those going through their own transplant journey. Before we begin, just a friendly reminder that if you'd like to submit any questions towards any of our speakers during the session, please write them in the Q&A box. It's either at the top or bottom of your screen. We'll be answering questions at the end during the Q&A portion, but get them in and I'll make sure they get to all the speakers. So it's my pleasure to introduce our first speaker, who is Dr. Joseph Kim. Dr. Kim is a staff nephrologist at the Division of Nephrology and the Director of Kidney Transplant Program at the Toronto General Hospital, University Health Network. He is also an associate producer at the Department of Medicine at the Institute of Health Policy Management and Evaluation at the University of Toronto. Dr. Kim completed medical school, internal medicine residency, chief medical residency, and fellowship in the nephrology and kidney transplantation at the University of Toronto. In 2008, he earned a PhD in epidemiology and a master's of health science and biostatistics at the Johns Hopkins Bloomberg School of Public Health. In 2020, he completed a global executive MBA for healthcare and the life sciences at Rotman School of Management, University of Toronto. Dr. Kim's research interests include access to outcomes of kidney transplants using center and population-based cohorts and optimizing the use of data to inform health system improvements, which I'd love to hear about. So without further ado, I pass it over to you, Dr. Kim.
Thank you, Dan. Appreciate it. Can you hear me all right? Okay, great. Thank you. I'm just going to share my screen. Hope everyone can see this. So I'll just full screen that. All right, so thank you. It's a real pleasure to be here to speak at the symposium. I'm going to share with you for the next 20 to 25 minutes or so the issues around expectations and reality as it relates to kidney transplantation and helping sort of you identify some of the potential challenges that might face a kidney transplant recipient after transplant, but also I want to sort of put a positive lens as well on sort of what you can expect, but being realistic about sort of things that we do need to be vigilant about afterwards. But of course, the goal of kidney transplantation is to bring people back to a semblance of a normal and full life, and that's what we sort of aspire to achieve, and frequently we are successful in that context. So this is the outline. So these are sort of a bunch of sort of topics that I'm going to sort of cover over the course of the presentation. So you'll see here sort of points around the kidney transplant surgery and what it means, recovering after transplant, the issue of the transplant medications, which will be sort of elaborated in much more detail by Deepika Manuel, who'll be following me, one of our transplant pharmacists here at UHN. And I sort of call them the frenemies, and you'll see why I sort of mention that. I'll also provide some insights about your blood work and what to expect around sort of understanding them. Asking the question, are complications after transplantation inevitable? This is an important question that I think many patients have, and we'll address that together. I also want to emphasize the importance of kidney transplantation as a team sport, so to speak. And of course, pretty much all healthcare should be a team sport, but kidney transplant in particular is very important in that regard. So I'll just elaborate more on what I mean by that. And then address a few of the issues around what it means to get back to a normal life after transplantation. And then finally, sort of highlight the sort of the issue of treatment or cure when it comes to kidney transplant. What does it actually sort of represent? And as a result, how should we think about it moving forward? So moving on first to the kidney transplant surgery, and is this where the journey begins? So just to provide you some details, you can see graphical or sort of a figure on the right-hand side of your screen that sort of highlights where the transplant goes and sort of the anatomy thereof. The kidney transplant is what we call a heterotopic procedure. What does that mean? Well, unlike other transplants of the liver or the heart and lung, which are known as orthotopic transplants, where you replace the existing organ with the new organ, in the for kidney transplant, your own kidneys, as you can see in the diagram there, it's known as atrophic native kidneys. We tend to leave them where they are. We don't touch them as long as they're not causing any mischief. And we put the new kidney in a different place, and in particular, usually in what's called the iliac fossa, or the lower quadrant of the abdomen, typically on the right side, but also potentially on the left. And you'll see there in the diagram, the new kidney situated there in the right lower quadrant. The blood vessels, the red tube and the blue tubes are then connected to the major blood vessels of the leg of that side. The brownish yellow tube called a ureter, which is the drainage tube that comes out of the new kidney to drain the urine into the bladder, which is in the lower central part of the abdomen, is also then connected as well. And currently, the transplant itself is done through typically an open procedure, which means an incision is required, and the surgeons will have to require direct visualization of the vessels and where the kidney is going to go. For a living donor surgery, on the other hand, where we recover the kidney from a living donor, it's usually done laparoscopically, so through little holes where cameras and pincers can be introduced. Can't do that quite yet for the recipient side, although there are evolving sort of techniques around robotic surgery where we may be able to sort of advance this further. But for the time being, the safest approach is what we call an open surgery. It does require general anesthesia, of course. You have to be appropriately asleep to have the procedure done. And typically, it varies, but typically the surgery runs anywhere from about 4 to 5 hours. I'm sort of being generous there, usually closer to 4 hours. And overall, as I said, the surgery itself has now become fairly standard and routine. And so has been the procedure itself does not require anything sort of elaborate apart from sort of its standard approaches that we know about. So one point that I wanted to highlight in the theme of expectation versus reality is, trying to prepare yourself to be a good surgical candidate doesn't mean you just come to surgery as you are per se and everything will go fine. My sort of thing that I want to emphasize today is that your chance of a successful surgical outcome in many ways will be determined by how you prep yourself long in advance of surgery. And in particular, while you're on dialysis or with chronic kidney disease, the issue of health maintenance and maintaining a good health status is very, very important for your general well-being prior to transplant, but also for the success of transplantation and the surgery itself. So maintaining regular exercise regimen, which of course we all should be doing, will improve your heart fitness, muscle function, and generally will shorten your recovery time after surgery. The other thing is, if you can strive towards more of an optimal body weight relative to your height, of course, that will also improve wound healing and improve sort of recovery as well. Eating a balanced kidney diet that provides all the relevant nutritions, of course, will then also promote better healing and recovery after surgery. And moving towards a surgery as well, be mindful of your blood sugar, even if you don't have diabetes, to make sure that that's being maintained at a good level. And typically, of course, the other facets of your health as it relates to exercise and maintaining good body weight and appropriate balanced nutrition will contribute to that cause as well. A very important piece that I emphasize very stringently with patients is stopping smoking. And I think we all know that smoking is not good for you. That's not the issue. We all intellectually understand that. But I just want to emphasize the importance of why smoking should be stopped. And here it's not just the issues around heart health and the lungs and the cancer risk, as well as the potential for stroke and other health related problems. There's quite compelling data that supports that smoking after a kidney transplant pretty much assure that kidney transplant doesn't last as long. And so a kidney transplant seems to be particularly sensitive to the adverse effects of smoking. So every investment should be made in advance to stop smoking if at all possible, moving into the transplant and making that investment long term after as well. Very, very important. Okay, so what to expect after the kidney transplant during the recovery phase? So recovery in hospital after kidney transplant surgery is typically on the order of anywhere from 5 to 10 days. So it can vary. It depends on one's course after transplant. And usually a living donor kidney transplant has a typically shorter stay than a deceased donor transplant. And the reason being there is that with a living donor kidney transplant, the surgery itself can be booked in advance. We know when it's going to be done. The workup and everything is done just not that long beforehand. So we've got to optimize all those pieces. And also the kidney tends to work right away, and so there's no delay in the function piece, so that there's no need for dialysis typically after transplant as a temporizing measure until the kidney recovers. As I mentioned in the second bullet, the deceased donor kidney transplants, a certain proportion of them will not recover right away, require some time, a few days to even a week or so, maybe even longer for some patients. And so in that interim, some dialysis may be necessary to support the body's needs, and then the kidney generally tends to recover there afterwards. The first couple of days is where the most intensive monitoring tends to occur, and so where sort of you'll be monitoring in a little bit more of an intensive setting for the appropriate fluid and medication administration, as well as to monitor for complications as well. But thereafterwards, patients are typically sort of transitioned to the general transplant ward, where ongoing recovery can happen thereafter. So what are potential postoperative complications? So these are the potential issues and problems, but of course our goal is to have patients optimized going into a transplant so that the risk of these sort of complications are very low. And again, a big part of that is your health status going into the transplant. So doing everything you can to invest in your health and taking those necessary sort of steps to ensure that that's the case before going in will really sort of help to minimize the risk. But things like wound problems, so what we call dehiscence, so when the wound sort of breaks down and opens up after surgery. Typically that's because of infection or other complications can occur, although not very common. Urinary tract infections, pneumonias, and other sorts of infections can occur postoperatively, sometimes due to, for example, in the urinary tract catheterization, because we do need to put a catheter in the bladder to allow the bladder to drain first few days to allow that new connection with the transplant kidney to heal. But generally we do try to take it out as early as possible so it minimizes the risk of infection, but sometimes it happens, and so we have to be mindful of that. Pneumonias can happen after any surgery, after one has received general anesthesia, because of the lungs sort of collapsing down a little bit because of the pain and the splinting that one might do, or one might not breathe as heavily or sort of as expansively as you would otherwise. So we provide you various tools, including an incentive spirometer, which is a little plastic contraption that you breathe into and expand your lungs. So all these things we can sort of put in some preventive measures to reduce the risk. Bleeding, blood clots, same thing as well. Some measures to help to reduce that risk. We monitor blood sugars carefully after the transplant just to make sure they're not rising. And there is also, of course, the potential to, especially if you have a prior history of heart disease or stroke, that there's a slightly higher risk of these complications afterwards as well. But again, various measures are taken to detect these things early if they do occur, and then appropriate treatments are applied as needed. So these are possible complications, but again, the key here is surveillance, monitoring, prevention, which all programs will implement, and also from the side of the patient, preparing themselves as much as possible from a health perspective going into the transplant to increase the likelihood of success there afterwards. The typical course after in the hospital is, we like to resume the diet early. We like to get patients mobilized so that we can avoid blood clots, for example. An ultrasound is usually done before discharge in some programs just to identify the anatomy and make sure everything looks good. Pain management is also important in the first few days. Narcotics can be used to sort of help with the wound discomfort, and there may be some narcotics that are prescribed afterwards for a short period of time after discharge, but typically after a couple of weeks, one can typically transition to just Tylenol, and usually the wound heals quite well there afterwards. Learning about your transplant medications will be key, and Devika will speak about this a little bit more, but that learning occurs in hospital, and actually to some extent, preferably even before hospital, to sort of help you understand what these are about. Some resources are available in that regards to help you, but the training that you have done in hospital, very important, and also what you do there afterwards as well. The resources provided to you will be very, very critical to your long-term success. Of course, the catheter, as I mentioned, will be removed usually around anywhere from between day 3, day 4 or so, depending on the program. And then very importantly, you'll get to meet and connect with your post-transplant clinic team. So there'll be a physician and a nurse, and typically an administrative assistant and others who will be sort of helping to coordinate your care afterwards. And these are the individuals that you'll get to know really well in the long term, will help support you and help navigate you through your post-transplant journey. All right, so your transplant medications are your frenemies. So there's a lot of medications or types of medications that we need to consider in the context of transplant. Not all of them are long-term. Many of them are short-term and can be either reduced or eliminated altogether over a span of weeks to months. However, immunosuppressive medications, which are the medications that help to keep the immune system in check to prevent the kidney from being rejected, are going to be part of your routine for as long as you have your kidney transplant. So it's an important sort of class of medications that you need to become familiar with. But there are other things that you will be sort of taking as well to help sort of, for example, control your blood pressure, manage your cholesterol, and if you have diabetes, medications there as well. Sometimes there are medications we need to use to optimize your bone health and other things to ensure that long-term you continue to stay healthy and benefit from your transplant. More specifically about the modern immunosuppressant medications. So they've truly revolutionized the way we do transplantation and the likelihood of long-term success. So they've really been instrumental in allowing us to make kidney transplantation the standard of care and the treatment of choice for people with kidney failure. However, the trade-off is that we do have to cause the immune system or suppress the immune system a little bit to allow it to sort of quote unquote accept the kidney, so to speak. And so it's important then to sort of consider the flip side and manage those other potential complications, be it infection and other sort of things that could happen at a slightly higher frequency because of those medications. But overall, when taken as prescribed and monitored carefully with your transplant team, including the blood tests and any side effects that you may experience, overall these medications are very well tolerated, and we can sort of strike the balance between the need for immunosuppression without overdoing it such that those other complications could become a problem. An important myth that I've heard from some patients is that eventually you'll be able to eliminate or significantly sort of get rid of most of the transplant medications. I will say just off the bat that is not true. Okay, so the vast majority of patients will require some of the transplant medications, if not most of them, in the long term, as long as you have a kidney transplant. The only scenarios where we may be able to significantly reduce the amount of immunosuppression you're on is if you receive a transplant from a perfectly matched donor, typically a sibling, which occurs about 1 in 4 times, so 25% chance from a sibling. In that context, there's a little more flexibility because the match is so good. But in general, the vast majority of patients require transplant medications as part of their day-to-day routine. And like I said, even though they're initially particularly, you may have some side effects and other things that we need to deal with to try to get it right with those adjustments along the way for the first few weeks to months. Eventually, there becomes sort of a regimen that works well, and we continue to maintain on that for the long term, and it just becomes part of your routine. So, as I said, making the transplant medications your routine is a very, very important one for the long-term success of kidney transplant. Anecdotally, I've seen patients with kidney transplants who lasted 30, 40 years. And every single one of those patients that I've encountered and I've had the pleasure of caring for have been extremely vigilant about their medications and would not accept missing a dose or taking their dose at an incorrect time. They were extremely vigilant about doing so. And for typically, those patients also would provide or help themselves by using various tools like a medication dosette box, where they sort of able to pre-fill their medications into sort of the days of the week, and then allow them to take it with them wherever they go and so forth, to allow themselves to remember to take those medications, using phone-based reminders and other things to help them along the way. Because look, we all live busy lives, and so we can naturally sometimes forget that we need to take a med, so we need to do everything we can to help ourselves be consistent in that regards. The blood tests you do will also not only monitor your general health, it'll also be important in monitoring sort of the level of the medication, certain medications that you're on, the immunosuppressant medications, to make sure that we're striking the balance between immunosuppression but not going overboard to prevent complications in the future. This is just a diagram from a paper that sort of highlights that adherence to medications is a spectrum. It's really not a you adhere or you don't adhere. You're going to be using these medications essentially for the rest of your life, or as long as you have your kidney transplant. So it's not always going to be perfect, but vigilance and efforts to make it as good as possible and move towards the right-hand side of this diagram with sort of the key points that are raised here is really, really important. So I think I can't emphasize enough the importance of sort of dedicating your efforts and routine towards ensuring that those medications are taken consistently. So understanding the ups and downs of your blood work. This is an important topic, particularly now that more and more patients have access to their blood work through their various labs or through the hospital and so forth. So interpreting these blood work can sometimes be quite challenging, especially for patients. And so I just want to highlight, so what would you sort of consider in that context? Well, remember, blood work can go up and down just as a part of natural variation. So it swings up to 5 to 10% from that baseline value. It's not uncommon. So really the key is the trajectory over time and trends over time. And if you're not sure, make sure that you consult with your team to find out sort of if there's any concerns that you may have, so that you can sort of address those concerns. The most common tests we do follow in the context of a kidney transplant are serum creatinine, which is a measure of kidney function, the urine tests that let us know if there's too much protein in the urine and other things that may concern us, potassium levels, of course, which is very commonly sort of surveyed in kidney patients. We continually monitor that as well. Liver tests, calcium, cholesterol, and also the blood panel to make sure that the hemoglobin and other measures are good. So there is usually a routine set that's monitored. And remember, blood work will be a part of your life ongoing. A kidney transplant requires ongoing surveillance. So the initial part might have blood work upwards of 2 to 3 times a week for the first month, but then eventually blood work can be sort of spaced out to the point that it's no more than once every month or even 3 months, depending on how well you're doing. The other key point to note is that any individual blood test might seem abnormal based on the normal values that are specified in the lab. But remember, like I said, trends over time and also interpreting blood work in the context of the other blood work is important. So this is where your healthcare team will be very important, providing you that context. So I think it's important not to be overly anxious about one reading per se, but nevertheless, it's important to connect with your team if there are concerns in that regards. And eventually, I think you become much more comfortable and familiar with what these mean. The issue of post-transplant complications, are they inevitable? Okay, and there's a number of complications that one can consider. Infections, different types of infections, the issue of cancer, certain types of cancers like skin cancer at a higher risk because of immunosuppression. Diabetes might become more of an issue, especially for those who may be tending towards diabetes prior to transplant. They may flip over to frank diabetes afterwards. Blood pressure issues, cholesterol issues, and risk factors related to heart disease and so forth may be an issue. But are they inevitable? No, they are not inevitable, and a lot of much investment should be made into prevention and surveillance and monitoring. And so we've all become familiar over the last couple of years during the pandemic to take those measures that are necessary to reduce the risk of airborne droplet-based viral infections. And it turns out that these sort of efforts are a good thing to continue to do regardless. And we also use various strategies, preventive agents like antibiotics as necessary, very importantly vaccines, flu vaccine, the COVID vaccine, and so forth. Very important part of your ongoing care and maintaining health. Cancer screening, as is typically done in the general population, should continue there afterwards for the long term. Very important, again, health maintenance and in optimizing your health. Regular exercise, which means moderate physical activity for at least 30 minutes a day. Moderate means a brisk walk or a jog on a treadmill. These sort of things go a long way to maintaining good health in the long term. A balanced diet, like I mentioned earlier, with moderate salt intake and reduced total calories is worthwhile investing as well. Blood sugar monitoring, and of course the appropriate use of medications to ensure ongoing health is very, very important. And then finally, in conjunction with all this, general risk factor modification for heart disease is very important. And this is going to come up again, smoking cessation, stopping smoking, a very, very important investment in one's health, which I can't emphasize enough its importance. So moving on to kidney transplant as a team sport. I don't think this is a new idea, that the team is an important one, and you as a patient will be the captain of that team, but your physicians, your nurse coordinators, administrative assistants, consultants, social workers, or pharmacists, as well as the inpatient team who may be caring for you if you develop an issue that requires you to be hospitalized, are all important members of the overall team who will provide you ongoing recommendations, input, and guidance to ensure that you can benefit from this kidney transplant long term. Of course, the other major important